Hello everyone, my name is Wang from Shandong Normal University in China. Today I'm going to present my work, prostate cancer detection using image-based features in dynamic contrast enhanced MRI. First of all, I'd like to give some background. Prostate cancer is the fourth most common cancer at a worldwide scale. A computer-aided diagnosis system based on multiparametric MRI, such as the tissue-weighted MRI, diffusion-weighted MRI, and DCE MRI, can improve the repeatability and accuracy in carrying out biopsy, diagnosis, and treatment planning. In the clinical practice, the PIRADS, which is short for prostate imaging, reporting, and data system, has been widely used to score the aggressiveness of the prostate cancer. It is notable that in PIRADS version 2, the role of DCE MRI becomes less important than in PIRADS version 1. However, DCE MRI possesses advantages over the other modalities, that is, it allows image analysis in both the spatial and time domains. Therefore, it is important to further explore the potential of the DCE MRI in prostate cancer detection. In the literature, there exist parametric and non-parametric approaches to model DCE MRI. Parametric approaches estimate a few parameters by fitting the pharmacokinetic models to the concentration curves. The non-parametric approaches estimate perfusion rate measurements by analyzing the shape and structure of the concentration curves. Both approaches estimate a few parameters from the DCE MRI series. They inevitably cause information loss and do not take the spatial information contained in the image series into account. Therefore, our work aims to investigate the performance of the image-based features extracted from DCE MRI for prostate cancer detection and to compare the results with the commonly used approaches. The dataset we used is I2CVB, which is publicly available. It contains 70 cases with biopsy-proven prostate cancer. The right figure shows the images of one case. The top row shows the original T2-weighted MRI images and the DCE series. The DCE MRI contains 40 series for each case. And the bottom row shows the annotations provided by the radiologist. For T2-weighted MRI, the annotations of the prostate gland, the peripheral zone, the transition zone, and the tumors were provided, and for DCE MRI, the annotation of the prostate gland was provided. In our experiments, we use the T2-weighted MRI to propagate its annotations to DCE, and for prostate cancer detection, we use the DCE MRI only. Our method consists of 3 steps: pre-processing, feature extraction, and classification. For pre-processing, we applied restriction to align T2W to DCE to propagate the annotations from T2W to DCE. Then we applied normalization to DCE MRI to reduce the interpatient intensity variations. After that, we applied the feature extraction. Four categories of features are extracted. The first category of features is estimated by using the pharmacokinetic models, which estimate a few features by fitting the pharmacokinetic models to the concentration curves. The pharmacokinetic models commonly used include the Briggs, the Hoffman, the Tofts, and the PAM model. Each model extracts 3 parameters from the DCE MRI series. And the second category of features extracted is the perfusion-related measurements, which analyzes the shape and structure of the concentration curves. This category of features includes the time features, the signal intensity features, the derivative and integral features, and the ratio features. The dimensionality for each category of the features is listed in the last column of the table. Then we extracted the image-based features such as the intensity, the statistical features, the gradient-based features, edges, filter responses, and the texture descriptors from each series of the DCE MRI. The dimensionality for each category of features is listed in the table. Finally, 5 anatomical features, including the relative distance to the center and the contour of the prostate, the relative position in the Euclidean and the cylindrical coordinate systems, and the zone location are extracted. For classification, since the dataset we used contains limited number of cases, we performed leave one out patient out cross-validation. The random forest is used as the classifier, and we calculate the area and the RC curve to evaluate the classification performance. In the first experiment, we compared the performance of using different categories of features for prostate cancer detection, including the image-based features, the perfusion-related measurements, and 4 different pharmacokinetic models. The results are illustrated in the figure. We can see that the BRICS model performs better than using the other 3 pharmacokinetic models. Using the perfusion rate measurements performs better results, and using the image-based features produces the best results. Then we tried aggregating all categories of features for prostate cancer detection. Considering the high dimensionality of the features, we applied feature selection. Percentile thresholds were set to select the most dominant features based on the Gini imputed values calculated in the random forest classification. The table shows the results generated by using different percentile thresholds. We can see that when selecting 15% of the features, we obtained the best results. Then we use the selected features to generate the probability maps. These figures show the probability maps generated by the random forest. In the probability maps, the red color indicates the high probability of being tumor. The white contour and the red contour depict the ground truth of the peripheral zone and the tumor. We can see from figure A to E that our method can accurately identify the tumor in the peripheral zone, in the transitional zone, and in both zones. However, the classification performance is poor for the last case with lots of false positives detected. This table shows the selected features used to produce the classification results. We can see that all four categories of features are selected, and for image-based features, we can see that the statistical features and the filter responses contribute the most compared to the intensity, the gradient-based features, the edges, and the texture descriptors. Then we can draw our conclusions that using the image-based features outperforms the other widely used approaches as it models both the spatial and temporal characteristics of the DCE series. Feature selection reduces the feature redundancy, removes the noise, and produces excellent performance. Image-based features, especially the statistical features and the filter responses, provide additional contribution to prostate cancer detection. Okay, that is my presentation. Thanks for your attention.